Connect. We're getting started. We're waiting to sync up on all our live platforms per usual. So once we are synced across all of them, we'll officially get started. Really excited for today's episode and our guest today. So just give us a few seconds here until they all sync up. And then for anyone who is watching too on LinkedIn, I'm taking a look at the chat down below. So if you have any questions or anything you want addressed during the episode, feel free to put them in the chat, and we'll do our best to integrate those topics into today's discussion. Okay, going live, almost there. All right, we're synced up on all platforms, so we're going to get started. So, welcome back to Coach Connect. Here's where we explore the. Excuse me, sorry, had a little pop here. Let me try one more time. Welcome back to Coach Connect. Here's where we explore the stories and strategies and insights from trailblazers who are transforming the world of coaching and well-being. What drives your success? What fuels your passion for helping others? We're here to uncover their secrets and share them with you. This show is brought to you by Vibe.io, the all-in-one coaching platform designed to empower coaches with tools, resources, and support they need to thrive and help their clients achieve meaningful, long-lasting growth. I'm Dr. Diego Salinas, your guide on this journey. As a neuroscientist, physician, and health coach, and co-founder of Vibely, I'm committed to celebrating the incredible work of coaches everywhere and helping them unlock their full potential. So together, let's dive in deep into what makes coaching a powerful force of change. Today's guest, Leigh-Ann Webster, is a passionate health and wellness leader committed to empowering individuals through coaching, outdoor experiences, and transformative health practices. She served as the board chair for the YMCA of Mission Valley in San Diego, California. Is an advisory board member for Preventa, a digital health platform that champions preventative care and sustainable lifestyle changes. As part of Mentor Agility, Leigh-Ann leads outreach, marketing, and publicity for Veterans Talking to Veterans program, a groundbreaking initiative that empowers veterans to coach other veterans with strong focus on post-traumatic growth, resilience, and health. Leigh-Ann is the founder of Outdoor Health Project, an organization dedicated to improving health and well-being through outdoor activities and adventures. As a fierce advocate for lifestyle medicine, she's a member of the American College of Lifestyle Medicine and integrates its principles to all her work, from coaching to writing about health and wellness and outdoors. As an avid adventurer, Leigh-Ann has completed the iconic John Muir Trail, summited Mount Whitney multiple times, and participated in several endurance events. These experiences shaped her belief in transformative power of physical change, nature, and mental resilience. Leigh-Ann's prior role as executive director of the National Board of Health and Wellness Coach from 2015 to 2024 saw the organization grow into a global leader, certifying over 10,000 National Board of Health and Wellness coaches worldwide. As an alum of the University of California, San Diego, Leigh-Ann's a National Board of Health and Wellness Coach, certified personal trainer, and diabetes prevention lifestyle coach. She has spoken at numerous health conferences and continues to mentor emerging leaders in the field. While not working, Leigh-Ann also enjoys spending time with family, exploring national parks, cooking, and living the principles she teaches. Leigh-Ann, oh, so welcome to the episode, but she might have dropped off here. So let's give it a second for her to come back on camera. Part of going live, right? These things happen. There we are. Hey, Leigh-Ann.
Well, I have no idea what happened. Was that on my side?
Welcome back. It's okay. Part of going live. These things happen, right?
So, I'm like, uh-oh, what just happened?
I had a little glitch on my reader proper too. It was missing some letters, so you saw me stumbling through the letters. It was because I only saw every other one, so I was trying to make the best of it. But anyways,
Okay.
Leigh-Ann, welcome to the podcast. Really honored to have you on here. I've had a chance to meet you a few times here, and immense gratitude for all you've done in the field. But before we get started on that, people like to hear people's origin stories. Where did you find your passion for kind of this, for well-being, for nature, resilience? How did you get started in this field of well-being?
Well, let's see. Gosh, I mean, really, if I think back, I probably started around the age of 4. That was we were just talking about this in my family. That was my first backpacking trip. up into the Sierras. So I think I've always had like a real passion for being outside and for movement, and just always had a strong interest in um, being healthy and fit myself, but also in the psychology behind it, and
Mm,
what drives people to do hard things, right? Because like I really do think being healthy is hard, especially in this day and age, right? It's not
yeah,
easy.
yeah, yeah.
And so I think the journey has been going on since I was really a young kid. And then as an adult, I ended up in marketing and communications. Um, from my early 20s on, when I was in college, and then beyond that. And I found that a lot of the companies that I worked with were always health oriented.
Mm,
So I was the marketing director for an organization called Wild Oats Markets. They were a competitor of Whole Foods, and that was all about the natural food industry. And and then I eventually started my own business back in 1998, and found I was working with like a lot of physicians, nonprofits, food companies in the natural food industry, and so it's just kind of like everything just kind of kept moving towards healthy living, I guess you could say. Um,
hmm.
and then when I had my son in 2005, I decided to take a break because I had been running a company for quite some time. And
Let's see. Leigh-Ann, can you hear me? Let's see. Test, test. It seems to be frozen on my end. Let me double check. Let's see if I can. Looks like a little bit of technical issues, everyone. So we'll just wait a second for her to be able to hop back on, and we'll continue the show. Check, check. So everyone's listening. Sorry, it seems like Leanne's having a little bit of connection issues, so she's trying to log back on. And once she does, we'll resume. Kind of left me hanging as well. I'm kind of curious to hear the rest of the story. Let's see. Thank you everyone for your patience today. Try and get Leanne back onto the platform here, onto the live event. And for those who are listening live, is there any questions? I'm also monitoring the chat on LinkedIn. So if you have a question for our guests or for us today about the national boards, where the future of health and wellness coaching, please let us know so we can address those questions in the chat. There we go. Hey, Leanne.
I have no idea what's going on, but I am so sorry to do that to you. I ended up trying to, it just kicked me off on my computer and I downloaded the app on my phone. So I guess
That was quick. Wow.
it's all,
You did all
well,
that that time. Wow.
it's all about finding solutions, right?
Yep, Leanne, I'll tell you the same thing happened to me last year. It kicked me off my computer. It froze. So I had my phone as a backup. So I always have it open. I'm surprised how quickly we download it and sign on. And adaptability and flexibility, right?
Yeah,
That
well,
resiliency you mentioned.
right, exactly, right? Like be solution oriented. That's what I always tell my son. Figure it out, be
Nice.
solution oriented. So hopefully we're good. I'm so sorry about that.
It's okay. Part of it happened lives, right? It's like coaching. We go with what happens in real life, right? And
Yep.
I think speaking of your son, I think it got cut off right when you're mentioning that. I think you had your son in 2005 and took a step back. I think it's where it cut off there.
Okay, yeah. So in 2005, I had a baby, and it's hard to believe that was 19 years ago. Um, but I really wanted to take some time off, be a full-time mom, and kind of figure out what was next. And after some deep thinking and everything, I realized that I wanted to be a health and wellness coach and a personal trainer. So at that time, there were a lot less health and wellness coach training organizations, and it was also harder to find them, right? Because
Hmm.
you'd go online, but you just weren't sure what you were getting. I ended up going with Well Coaches, and
Hmm.
it was a great experience, fantastic experience. And then I launched a business called 52 Healthy Weeks, and I started offering coaching and personal training, and
Mm.
just building that business. So,
Okay. And something you
yeah,
said earlier there really struck me, Leanne, that health is hard. That was a great phrase, right? Being healthy is hard. Like
it is hard.
it's always kind of pictured almost like this fluid kind of, it's kind of, I'm a healthy person. It's just it's kind of, happening naturally, but really it does take a lot of energy to do something and maintain those healthy habits.
It does, yeah. And I think when you are healthy or you look like you're, in shape, people just assume it might come easy. But it doesn't. I don't think it comes easy for any of us,
Mm.
especially as we all age, right? We all age every day. And
Hmm.
also just like the way American society is set up, or really societies throughout most of the world. Um, most people sit for their jobs, and and then those that don't sit, like you can think of like shift workers, maybe, right? Like a shift worker who's yeah, building automobiles or something. um they may not be sitting, but they don't often have the energy after their job to actually work on their health, right? So
Hmm.
even if
Yeah.
you're not sitting, it's still hard. um
Yeah.
so
Right.
yeah, I would say health is hard.
Health is hard. Yeah, that's a great point. I think it sometimes seems like it's portrayed as this thing that you either are or you're not, but people don't see the energy behind it. And it reminded me when I was watching someone skate. Someone goes, "Oh, it looks so effortless." And someone
Mhm,
said, "When it
mhm,
looks effortless, when
mhm,
someone's doing something that looks effortless, there's a lot of effort behind
mhm.
getting to that place."
Absolutely. Yep. That is very true. Yeah. I would say that with backpacking as well, right? Like,
Yeah.
you might be on the top of a peak, and you may look relaxed, and like, you're having a good snack and just looking at the view, but the effort that it took to get there could literally have been like 10 hours.
Yeah. Yeah. Or even you might not see on the outside that blister that you feel is forming in your right shoe, but
Totally.
people aren't seeing that,
Yes.
right? They're thinking, "Oh,
Yeah.
look how happy you are there," but the
Sure.
happiness comes from all that work you put in to get there, despite the difficulty.
Yep, yep. And I think too, like social media in a lot of ways doesn't necessarily help people realize that health is hard, because
Exactly.
most of the time people are going to post the beautiful shot, right? The picture of them skating effortlessly, as you might do, or me at the top of a mountain, right? And there's a lot that goes into not just that day, but also like all the preparation prior.
Yeah, this reminds you of this overnight success, right? Look at business. Oh, overnight success. Overnight success, you're just now learning about it. There's also probably 5, 10, 15 years to
Sure.
get to that overnight success.
Yep, yep, yep.
Yeah.
Yeah.
I see it also, Leanne, a lot. And in kind of my realm was to help parents out, right? I think social media, people talk about only the nice part of parenting, those beautiful moments and how lucky they are, but then they don't address the hardships, the lack of sleep or frustration with your kids or the stress there too. So everyone's thinking, why am I the only parent who suffers or has a hard time bonding with my kid early on in the first few years of
Hmm.
life? Or the only parent who, it's all parents I work with. Listen, it's normal to at one point, no matter how much you love your kid, be like, I just need like 3 hours to not look at you for a
Oh,
second.
absolutely.
Right?
Yeah,
And it's a
definitely.
normal part of parenting versus like, oh, this shame and guilt that what's wrong with me that I need space for my kid or family.
Right, right.
Yeah.
I think we actually all need space, right? Like we all need, it's interesting because I think a lot about community and connection,
Hmm.
right? And there's just so much evidence to support that we have like a deep innate human desire for that. And there's the loneliness epidemic.
Hmm.
And at the same time, we all need our space. So
Yeah.
it's like finding that balance between the two, um, to be emotionally satisfied, emotionally connected with others, yet like having that time for yourself to do whatever it is you need to do alone.
Yeah. Again, for every person, that point is different. That balance will change throughout time. And the way I started viewing that, Leanne, is almost like it's a you have to also throughout life develop more that relationship with yourself. I think the older I
Hmm.
get, the more I realize like you have to be with yourself. You're with yourself 24/7. And
Yeah,
that's the first relationship you have to really foster.
yeah,
If you don't tend
totally.
to that relationship, the other ones are gonna be hard to really connect in a deeper, meaningful way.
Yep. I always say, like, wherever you go, there you are.
Wherever you
So
go, there you are.
doesn't really
Exactly.
matter. Like, if you don't solve your internal issues, whatever they may be, it's wherever you go, there you are with yourself.
Top of the mountain, there you are. Your mind is still thinking those
Yep.
things. Exactly.
Totally. Yep.
Yeah. And so speaking of effort, love to maybe transition down to, so you mentioned kind of your passion for well-being and nature always kind of leading to more paths. And then you mentioned initially finding a coach was hard or knowing where to train, you see all these things. Curious if we could talk about maybe this part of the journey started when how you started getting involved in the National Board of Wellness Coaches,
Sure.
how the course kind of maybe started. I'm sure you told a million times, but to our listeners or new coaches here, kind of give us a little bit of behind the scenes of the genesis of this and kind of your role in there.
Totally. Yeah. So when I started 52 Healthy Weeks, one of the things that I did was join the local Chamber of Commerce here in San Diego, because as much as the internet and social media is part of building a business, I also really believe that getting connected with people and seeing them in person makes a huge difference. And what I found when I would go to the chamber meetings was that people were very enthusiastic about hearing about what I was doing and what my business was all about. However, there was always this question about, well, who certifies health coaches? Tell me more. Can anyone be a health coach? And there were always like a lot of questions. And then as I continued to build the business, I found that I would meet a lot of physicians,
Hmm.
and physicians are very evidence based, right? They want to know the data behind what is being done. This is to
Right.
right, summarize it, right? And at that point in time, there wasn't the compendium of health and wellness coaching literature. There was no unifying body. There wasn't anything, right? And so I found that there was a lot of support from individuals or physicians who wanted to learn more and were really interested in the field,
Hmm.
but there was definitely this barrier. And
Mm.
so I kept building my business and found that I was still able to build it, especially if I focused on the personal training side of it. But back in, let's see, it would have been around early 2015, like January of 2015, probably. I received an email about this part-time position to support the work of At that time, it was called the National Consortium for the Credentialing of Health and Wellness Coaches, NCCHWC. That was the first name of NBHWC. And they were looking for somebody who could help fill a need, and administratively, marketing wise, all of it. And so I applied for the position and I got it, and realized really on day one that this was no part-time job. This was like absolute insanity.
Sure.
And the board had been working on it since really, became like a formal nonprofit entity in 2012, right? So there was this incredibly dedicated group of people, Margaret Moore, Ruth Wolliver, Linda Bark, Meg Jordan, Michael Arlusky. I know I'm missing someone, and I'm so sorry that I am. But there was this group of people. They were meeting once a week for an hour and a half every single Tuesday, trying to move the needle forward to really professionalize the field and unify the field of health and wellness coaching. So I was hire number one, and they sent me a box. It was this big file box full of documents, full of papers, and basically it was my job to like turn that into a business. So I was like, this
Yeah,
is
part-time little thing, right?
yeah. I mean, it was crazy. It was just crazy. And at that point, it was like 100%, you know, being funded by donors, right? Like there were just a lot of organizations, schools that really believed in this. And so, you know, I had to organize all that and just all of it. And so that was really the beginning. At that point, the board was just formalizing the standards for the health coach training programs, right? So we launched
That
that.
blueprint.
Yeah. We
Yeah.
not even not necessarily the blueprint for the exam, but because
Okay.
that was like down the road. It was more
Okay.
the what should the job task analysis, right? Like the knowledge, tasks, and skills that a coach should know. So they identified those things. And then from there, they were able to identify what the program should be teaching. And so after that, like once all those things were identified, then we were able to launch program approval. And
Wow.
that launched in July. It was July 1st, 2015. And I'll never forget because I remember thinking, why in the world are we launching this 3 days before the 4th of July? Like, this is going to make my life crazy. And it did. It was crazy because we thought there would be, I remember like I was speaking with Margaret Moore. She's the founder of Well Coaches and really helped lead the way, right? From the very beginning. Oh, and I remember who I forgot. Karen Lawson. Karen
I was
Lawson
gonna.
was
I
a
was like, I think it's
huge.
Karen. I was like, I think it's Karen, but I don't want to say it
No,
wrong. I
it's
was
yeah. Oh, I'm so sorry, Karen, if you're listening. She's a good person, good friend.
amazing
She was
person.
with University of Minnesota. So it was really Margaret and Karen who really had that initial first conversation, right? And so anyway, I remember talking with Margaret and she said, you know, maybe 10 to 15 programs would apply for program approval. By the end of that first year, we had more than 50. So it was just like absolutely crazy.
Yeah,
And then
wow.
luckily we were able to bring on Nicole Pope, who's still with the organization. Fantastic person, great friend. And she just, you know, is continuing to do an excellent job. Yeah. So anyway, I know I've gone on and on.
No,
But
it's a lot that you did. Though. I will say from the lit. So last year was with we kind of linked up again when I met with the that 2024 Competency Ethics Committee, right? And I was
oh,
really
yep,
excited to be
yep,
there. And
yep,
for kind of new listeners, Leigh-Ann, correct me where I'm wrong here, but you know, the first exam launched in 2017,
yep,
right? And then they hadn't updated the kind of standards since then, and so it has a
right,
committee to say, let's see if the field is evolving. What should we be doing as an organization to kind of reflect that and if we're asking our coaches to continue to learn, the organization also continue to evolve, right? So they
right,
had
yep,
application for people to be a subject matter expert here, but also they did a lot of research in the back end about coaches and programs, kind of get feedback, what's
Correct.
happening in the field all across it, combine all that research with the experts to say, how should we update this? I'll be honest with you, super thrilled and honored to be part of that committee, because
Yeah.
like many people, when they found coaching, I didn't really fully appreciate what it was.
Right. Right.
And I trained at Duke, and when I saw a live demo, Linda Smith did, I was like, oh my God, this is not teaching, this is cognitive behavioral neuroscience. And then when they said, oh, by the way, there's this thing now you can board certified, I was like, oh, the board's at the same medical. I was like, oh, right. So then I found out about that same for day one. I was like, this is amazing. And
Yeah.
really, what a debt of gratitude to like the work to get started, because even the little that I saw from this committee, how much effort it took to really do that job task analysis and the nuance of defining the skills and knowledge what has to
Totally.
happen. And we thought it was going to be, a few day kind of event. And then it became
Right.
really the most of the year, kind of
I
continue to
remember
evolve.
that. Yeah, I
Right?
remember like, oh boy, this is going to be big. Yep.
Yeah.
Yep.
And so my thought too there was like, this was so hard to even update. I can't imagine from zero, from scratch, starting to define it. That was something I really took away of like, I really don't know what it was like, but I can't imagine going from zero to nothing versus from, the next level up. So immense debt of gratitude for you and all the people we mentioned, and everyone else who really laid that foundation for this to now become the organization it is now, and increasing that awareness of what the field is, and that it is standardized. There is more awareness, more and other benefits that maybe I'll let you take over here, Leigh-Ann. Kind of, so you started, got off the
Well,
ground. Curious.
yeah,
Oh, good.
I just want to say a key thing to point out too is that so what you're talking about, that actual like development of the job task analysis was happening in 2014. And what was really difficult, and I wasn't with the organization yet, but what was really difficult was bringing the field together. Uh-oh, are you there? Diego, are you there?
Yeah, I'm here. I can still hear. It was cutting off a little.
Oh,
Yeah, test,
okay.
test. Can you hear me? Test,
Yeah,
test.
I hear you. Yep. Yep.
Okay.
I
Yeah.
don't know where it cut off. All of a sudden you were coming back
I was
on.
able to hear you, but maybe you want to start from scratch just in case. I don't know if it was my end or your end, but if you want to start that sentence over,
Okay,
but I was able
sure.
to hear what you were saying. Hmm?
Okay. Basically, like something that people probably don't think about is that when they were trying to unify the field and to identify the knowledge, tasks, and skills, there were all these organizations teaching coaching, but not necessarily using the same words, the same language, or even believing necessarily that it was the same thing, right? So
Okay, right.
they had to come together and actually agree as to what was the definition of coaching,
Mm,
what were the basic foundational skills that someone should have. That was like a lot of negotiating just to get to that point.
yeah.
um,
Wow.
so I wanted to point that out. And then the other thing is, I know there's probably some coaches here who are not board certified, or some coaches who are recently board certified. But I just really wanted to highlight something that's incredibly significant if you're trying to build your business and have conversations with people about coaching. And that is the partnership between the National Board for Health and Wellness Coaching and the National Board of Medical Examiners. So NBME became affiliated, or I should say NBHWC became affiliated with NBME in 2016. And for those who are not like that familiar with medicine and physicians, NBME is the organization that board certifies physicians. So I say this because it's really important for coaches to understand that. I always tell people, go on NBME's website, it's nbme.org, and just see everything that they do and learn a little bit more about testing and development and competencies, as you were talking about before, updating that content outline. Learn more about it. There's a lot of really great resources on that website. And I think when you can get to the point where you can speak more clearly about like board certification, that affiliation, it really helps build credibility for what you're trying to do, whether it's with, if you're an entrepreneur and you're working with individuals who hire health coaches, or if you're in corporate wellness, and you're trying to get the respect of companies that may want to hire you, or if you're working your way into healthcare and you're trying to get that respect of the healthcare team, whether it be physicians, nurses, nurse practitioners, talk about that board certification and that partnership.
Yeah, Leigh-Ann, thank you for bringing it up. I think that can't be understated.
Right.
Right, that is, again, when I heard about that, it was, and even I'll tell a personal story. So all my friends in residency, all my friends who are, in medicine, you know, all kept in touch. What are you doing? Oh, I took this coaching program. It's really cool. Behavior change, neuroscience. They're all excited, right? When I told them I was board certified, they're like, "Oh, you're what?" I'm like, "Guys, where's the excitement 6 months ago? These
Right.
are my
Right.
dear friends." Do you know what I'm saying?
Yeah.
Like, so,
Yeah.
and people who know and trust me and love me. And so it is, if you can speak someone's language, right? Say, and I remember pulling up in Philadelphia for the committee and seeing MBME. And I was like, I was here 12 years ago doing medical step exams.
Oh, wow. Wow.
Right. So it was like this full
Yeah.
circle moment, but you're right. Cause now here's the reality. Look at the healthcare background. People in healthcare are left and right being, promised something, sold something, everyone wants our attention. If you can speak the same language as your provider,
Yeah.
yeah, I'm board certified. And even to your client work, right? So if you tell
Right.
clients,
Right.
hey, I'm board certified on this, it's a subset the way your doctor is board certified, dermatologist, pediatrician, whatever it is. I'm a board certified health and wellness coach following the science
Right.
that helps and as preaching the choir here, but there's a lot of evidence has to be presented for the boards to listen. For the
Right.
medical board, right?
Exactly. Yeah.
There's
Yeah.
overwhelming evidence
Right.
supporting that got
Right.
us here, right? I think that's a huge differentiation because that word coach can be so used by anyone. I
Oh my
hear often,
gosh. Yeah.
I love people, I'm a coach, and people might have heard me say this. Yeah, I love my dog, I'm not a vet. And
Right.
having
Right.
the MBM, the National Board of Health and Wellness Coaches, really does help distinguish that there is a certified organization, continuing education, standardization that's based in science and evidence. And this is
Right.
how you apply the art of the science.
Right. Totally. Yeah. And I think too, because credentialing organizations, there is no, people can say, I certify people in this, right? Whatever this might be. And it's really important to note that it's the National Board of Medical Examiners because that offers a lot of credibility. But also, I think as a coach, it's important to really understand what certification means and what it even is. And so, a lot
Mhm.
of times, I'll tell people, hey, spend an hour on, it's called the Institute for Credentialing Excellence, ICE. Spend an hour on their website just to learn more about credentialing, right? Like, what does it mean to have a credential or a certification? And be able to just take some of that knowledge and add it to your sales pitch, essentially, right? Because that's really what you're doing is you're
Yeah.
trying to sell coaching. But if you can even just understand credentialing a little bit better, understand the relationship between MBME and NBHWC, I think you can get a lot further and a lot more respect, especially because there isn't a license for
Mhm.
the profession of health and wellness coaching, right?
Mhm.
And so I've heard a lot of people say, "Oh, I'm licensed as a coach," and I'm like, no, it's a board certification, it's a credential." So just really, I think people need to take time to understand that so that they're presenting the right information in the right way.
Yeah, 100%. And it can be confusing at first if you're not sure, but
It
like you said,
is. Oh,
it's all there online. It was confusing for people in the field to understand these things, right? So
totally. Yeah. Yeah.
so it's there, but it's like our client work. It's a process. You'll learn the process, and I think that what it helps do really is create that trust, right? You mentioned the
Right.
sales call, like, or you're connecting. People need to have some sort of trust, and now you have the backing of these big organizations that already are trusted because they
Right.
have rigorous standards and there's transparency in how they do things versus
Yeah.
just, oh, well, I'm someone with a webcam who's calling myself a coach. It's like, no,
Right.
there's that trust behind it. And the more clearly you can speak to that and the scope of practice, right? Because you
Yeah.
mentioned credentialing, licensure, and what you do and what you don't do. The clarity of how you present this, even the limitations of what you can't do, does help you be that professional when you're
Yeah.
connecting with other professionals, whether it's in the hospital setting or boardroom setting. But you really want to me, I was really, it opened my eyes like, wait, there's a board certification for this. This can actually go full board because it's you
Right.
guys planted that seed for this to have those roots that this can grow from that foundation. Actually,
Definitely.
Leigh-Ann, could you maybe people have often asked that question, certification, licensure, and there's a lot of discussion on pros and cons of both. There's
Yeah.
all opinions there.
Uh-oh.
Before people dive into an hour
Oh no, you're cutting out.
how would you describe to people listening? Oh no,
I know, it's
It's like
so
one of those tech
weird.
days.
I'm
That's kind
like,
of a
I don't know what's
it's all over
going
the place.
on.
Life
Yeah,
happens. Let me restart. I was saying if you could maybe just briefly to those listening, kind of describe certification versus licensure. I know it's an ongoing discussion in the
sure.
field and
Yeah,
kind of pros and cons, but from high level, how would you describe someone who doesn't know those differences?
sure. So that's a good question. No one's actually asked me to explain it, but so this is a good test. Um, Licensure comes at the state level, right? So if you look at the profession of health and wellness coaching, there has been to date no state that is licensing health and wellness coaching at this point, right?
Mm,
An example of like a profession that is licensed would be uh, hairstylists, or
mm,
right, like that is like something that you have to get a license from your state. Or a better example that I'm more familiar with would be a massage therapist, right? So
mm,
in the state of California, a massage therapist has to go to school. They have to maintain the credential. They have to recertify. They have to pay the state, and that licensure is coming from the state.
mhm,
Certification can actually come from any entity out there, right? There are lots of entities that are incredibly uh, respected. And then there's some that you've never heard of that decide to offer a credential. So I always urge people to really do the research behind who is actually providing that certification.
mhm.
So yeah, I'd say those are the main differences. The state controls licensure.
Yeah, and that's a great point about certification because if people are maybe interested in becoming a coach, right, or becoming a
Right.
health coach or a different kind of coach, there are different programs that will certify you, and then I would say as you're doing your research, make sure these programs are certified by those big organizations like the National Board of Health and Wellness Coaches, right? So,
Right.
for example,
Right.
you're well coach certified coach, and then you took the board exam, so now you're nationally board certified, right? I'm a
Right.
Duke certified health and wellness coach. Duke is under this Duke's program is under the NBHWC. So now I took that course plus the exam. I'm nationally board certified. So as you're doing
Exactly.
research, one thing I've seen too is that you mentioned anyone can have a nice LLC name and call it, the Institute of Holistic Wellbeing and Plants and
Yes.
certification.
Yes.
It has a nice name, but doesn't necessarily mean it's certified by this other organization, right? Because they
Right.
internally create their own internal certificates, right? So it is a
Correct.
wide range, and make sure you do your what their standards are, but if they are under a different organization that verifies or checks kind of the standards of what they're offering.
Yep, exactly. So it'd be like a third party, right? Like almost like a third party certifier that's certifying the certification body.
Right. Exactly.
Yeah.
And part of this trust and that forming connection too. I know you get asked a lot about this, but the idea that now I remember when I learned that, oh, because it's boards under the NBME, and there's all the work the National Board of Health and Wellness have done with the AMA, that you can now use health savings account, your federal savings account, as well as your CPT code for insurance billing. And so I know it's a big topic, but even if there's limited coverage, I will say that I was so thankful to know that because besides helping lower barriers, but even if someone doesn't have a health savings account because they didn't put money into it or their insurance doesn't cover it because it's a class 3 code, it's optional reimbursement. It's still, for people listening, it's like, oh, it must be a real thing. If it's billable by insurance, if I can use my health savings account to pay for this, that again shows trust that this is actually a real skill set of a profession helping on well-being, right? So even if clients aren't able to, um, bill directly or get reimbursement from it, the fact that it even exists, I think, is a big booster for the credibility of what we're doing.
Yeah, it's really helpful. And just to add a little bit of clarity to that. So the American Medical Association here in the United States oversees CPT codes, right? And there's category 1, and we'll say there are category 2, but they're not used very often. So, and I don't even know that much about them. But there's category 1 codes, there's category 3 codes, right? And it's the category 1 codes that normally have a billable code associated with them, right? And then health savings accounts, that's actually, if something is covered for the health, or if you can use your health savings account funds to cover a service, that's regulated by the IRS, right?
Okay.
So yeah, so there are two separate entities. It's so confusing, all of
Thank
it.
you for that clarification, Leigh-Ann.
Yeah,
Yeah.
but with the American Medical Association, for physicians, there are some codes that could work for the service of health and wellness coaching. And I will always say, it's it's a that's not for the coach to decide, right? That's for the physician and that healthcare organization to figure out, what is the service that they're offering within the healthcare system to the patient, and is that something that can also, is there a code that also could apply to the service of health and wellness coaching? And so that's something they figure out. And then with the health savings accounts, that is something that the coach can figure out, right? And I know NBHWC has resources about that. They have to contact NBHWC to get that, but I know that we sent that out back when I was with NBHWC. So I know it
Yeah.
exists.
Yeah, and for all the coaches there, who are board certified, when you log on, there's, I can put a link to it later on after the episode, but there's resources for us coaches, right? And one is that letter of medical necessity
Yes,
that
exactly.
the patients would send to the provider, who will basically say, I am seeing this person for X, Y, and Z condition, and it can be approved by coaching, and then that helps get them that reimbursement. And on those
Yep.
lines, I remember last year I was Dr. Jennifer Ludman. She used to be
Uh-huh.
the director for
Yeah.
the program approval, right? And so I had asked her about this. I was like, "Hey, which of this? Give me some examples of codes that are covered, that have been successfully covered, or conditions with these letters
Yep.
of necessities." And her response, I think, was really, I really appreciate. It was eye opening, saying we shouldn't limit it. It should be every code, because
Mm-hmm.
every condition can be prevented, or the treatment can be supported through behavior change. So let's not limit to only this the kind of ones that come to my mind, but really, and I think the nice part about coaching, I'll say, even this discussion about HSA and insurance billing, it's beautiful seeing coaching helping that part of healthcare. But I think one of the most powerful parts is that you don't have to have a diagnosis or something that's wrong with you to be improved with coaching too. So as wonderful as coaching is in helping the traditional medical model, the sick care model, that kind of the acute phase, it's also a model that is transdiagnostic, that goes beyond diagnosis, and you don't have to have a dysfunction in order to want to optimize. So as much as this is
Right.
wonderful, I think we shouldn't limit it coaching to only in the hospital or acute settings. It could be this preventative or this just fulfillment kind of profession or service.
Absolutely. Yeah. Yeah. Because we're all eventually going to have something that isn't working right within our
Yeah.
bodies, right? So you should really start trying to work on your health when you're healthy,
Yeah.
when you feel good, right? Establish those habits when you're feeling good. So then when things are not going as well, you still have those habits that you've already established.
That resiliency you kind of mentioned, like resiliency is not only physical but also mental, and it goes both ways. So
For sure.
I remember when doing pediatrics, and the best predictor of maternity health is their health before pregnancy.
Uh-huh. Right. Yeah,
Right.
exactly.
So if you can be
Yeah,
healthy before pregnancy, and then we say do whatever activities that you were doing before while you're pregnant still, as long as
totally.
nothing too
Yeah.
heavy weights, etc. But the idea is keep on doing that because that's going to help you. A friend who's a physical therapist says motion is lotion, right? Like the
Oh
movement of the
yeah.
body keeps the body
Yeah.
moving.
Love that. Yep. That's good.
Yeah. So Leigh-Ann, so we kind of talked about the genesis of the national boards, all that amazing work you and everyone there have done. And I'm curious and we could definitely spend, I think, another hour just
Oh, for
about some of
sure.
the learnings there. I mean, we're summarizing over a decade of stuff into, 20, 30 minutes. But I'm really also curious to think from all that you've seen, how you've seen it develop and grow. And we know last year you kind of stepped out and you want to do new things now, but where do you see like the future of health and wellness coaching or coaching in general? What are the things that are currently, you're having discussions with, or things that are on your mind, and then maybe possible trajectories or things, opportunities for us to continue to evolve? I'll leave it more general on purpose. So if you can,
Yeah. I
yeah,
mean, it's interesting because when I was with NBHWC, I worked really hard to have good relationships with everybody that I worked with, right? And I don't just mean the staff, I mean like all the coaches, all the training
yeah,
programs, and like it was really important to me and it still is. And so I managed to like still definitely be connected with a lot of the coaches and been able to see some of the amazing work that they're doing. So I would say like one of the things that I've really kind of watched evolve is that these coaches are realizing that in order to really build like a really successful business around coaching, they're specializing, right?
hmm,
So I think that the industry is evolving in that there's coaches out there that are specializing in certain areas. Um, so I know like one of the coaches, Laura Timbrook, she
yeah,
specializes in coaching shift workers. And I had never thought about that,
yeah,
right? But like it's a very unique niche that really should have some special coaches, working in it, right? Like,
right,
because shift workers are working like random hours and they're dealing with all different things that we're not necessarily dealing with if we're working 9 to 5, right? So
yeah,
I'd say like that's an area. Pediatrics, right? Like I've noticed that coaches are starting to recognize the importance of family coaching within pediatrics, really important. So I'm seeing that. Military.
hmm,
I actually attended last week. The American College of Lifestyle Medicine had um, 3 people on who were talking about health and well-being in the military and how there's an issue that people are not healthy enough. They are not fit enough to even go
mm,
into the military. And then, there's the whole health and well-being within the military. And then upon exiting, the health and well-being of the veterans, right?
right,
So
right,
in that presentation, they had somebody talking. He works with veterans, but at the Air Force Academy, and he's a physician, and he was talking about coaching, right?
hmm,
Coaching within the Air Force and with veterans. And then I personally took on a contract role, it's a part-time contract role with one of the organizations that trains health and wellness coaches, Mentor Agility, and they are training veterans. They have a program called Veterans Talking to Veterans. And it's so cool because these veterans are being trained as coaches.
yeah,
They can go on to get their board certification or ICF or both, and they are coaching other veterans. And so I see that in the military as well, and with veterans. And then the other one I wanted to point out is schools.
hmm,
Um, so I know here in the state of California, there's a coach training program through the state It is not NBHWC certified. However, I'm happy to at least see that they're placing some importance on the role of coaching in school systems, right? And hopefully more states will follow suit, but adhere to the National Board for Health and Wellness coaching standards. So
Yeah.
military schools, pediatrics, shift working. I mean, there, obviously like the list goes on and on, but those are just 4 that I see a lot that I wanted to highlight.
A few things I want to say, even before you mentioned those things, you mentioned talking to coaches. I remember when I met you again at the conference last year. I forgot where we had first met, and you're like, "Yeah, I remember you." I was like, "How do you remember me? You meet so many people all along." So Leigh-Ann is genuine, who says she is. Like, she actually does talk to the coaches, like remembers them. Like, I was like, everyone's wanting your attention, and you do have this ability to. You're so genuine, authentic. So I remember I really stood out to me, and I think it's where your passions come through. And to specialization, I remember when I took that coach training program, right? So the first thing, the reason this podcast, Leigh-Ann, is called Coach Connect, because I wrote in my binder, Coach Connect, cut out the middlemen, make this more accessible. But below that, then I asked a question. I was like, hey, is anyone doing this for families or pediatrics, like for adolescents?
Yeah.
That was my first thought, but my background.
Yeah.
And I remember the instructor, she said, she's like, well, no, because the brain's not formed until you're 25. You can't do it. And I was like, that doesn't seem right. And so I wrote below that the part I don't tell the story. I put family coaching adolescents.
Yeah.
And so I started doing that, and now seeing that there's programs that are board approved that special pediatrics might have on episode one day, that there are companies now doing this. And even for schools, right? Like I coached for a year at a university for undergrads and graduate and professional students. And what an amazing tool, because they're going through so much constant change in their life, and they're exploring who they are, all these values coming up, and also organization. Like we was coaching, how do we put these pieces together, right? And there's such a, speaking of prevention, right? If I had this when I was in high school or in college, I wish I had these tools to improve, not just only get help when there's dysfunction or you feel overwhelmed, right? That it's always there, and hopefully normalizing us wanting to work on each other or work on ourselves, better said, excuse me, right? That's not a sign of, oh, I'm in trouble, something's bad. It's like, no, it's part of human development. It's just a normal thing. And I think the college students got it, because maybe the setting, you're going to go into classes, might as well get for coach. It's kind of, you're in this open mindset. And I think it's beautiful to see, hopefully, that become the standard. We normalize that, I used to say, I want physicians to think about, okay, when someone sprains their ankle, physical therapy. When someone has an accident, occupational therapy. They have problems with talking or swallowing, speech therapy. They're a human being, health coaching. Because regardless of diagnosis, it's just, you could always use that support, or at some point in your life.
Yeah, that's a great analogy. I love it. And I love that you brought up coaching in university settings. I can't believe I missed that one, because that's huge, right? Like we see that in a lot of universities bringing on coaches. And I love that. And then the other one that I didn't bring up, which I've seen a lot, is first responders.
Yes.
That's another one where it's really, I've talked with a few different firemen or firefighters, firefighters who have wanted to become board certified health coaches and then start offering coaches to other first responders. So, I mean, there's so many places this can go, right? It's fun to talk about.
That's the beauty of it, I think, Leigh-Ann. And so you mentioned Laura Timbrook. She was actually our first guest on the podcast, episode 2.
Oh, cool.
I met her at the same conference, and I was like, this is a great topic, having done shift work. And to me, that's why part of my vision with Vibely, honestly, is that standard is that creativity start flourishing. Because I remember when I sat down in that program, and I had this idea like, oh my God, I can use my background in neuroscience and peds, and but I'm like, someone else. Let me step back. To me, coaching is this lens of evidence-based transition and transformation. But then we can add to that lens our different resources, because our experience and knowledge, but also our passions. And if you look at what predicts success in therapy and coaching, it's really therapeutic alliance, right? And doing the right skill set, if you're doing it correct. So then on the provider side, or on the client side, there's certain factors, right? Where are the theory of change model? How ready are they? But on the provider side, it's that passion, authenticity, right? Laura, working with those shift co-workers, understands a different perspective, or that population well. I've done a coach training program also. It's meant for veterans. It wasn't approved by the boards, but someone told me it's trauma-informed work, and seeing people support each other. You know, when I had medical students that I was coaching, they're like, yeah, you understand what's like to be in rounds. It's a different level of support. Now, it doesn't mean I tell them what I did in rounds. I'm still using coaching, right? But there's this level of even adaptability. For example, I coach by time, not by session number. It's a weird thing that I kind of developed, and it worked for me. I know other coaches who've, you mentioned your passions for walking outside, who do wilderness coaching. Kind of, you go and for a walk and do this. So to me, what I'm fascinated is like, where is the field going to go as we get more creative with how we combine coaching with our experiences, knowledge, resource, and really meeting our clients where they're at.
Right. Exactly.
In all these settings, right? That to me is the fun part. I'm hoping that, you know, not only me, but any people in the field can contribute to this scaling of creativity versus scaling by saying you have to do it in this way. Like, I want to give people tools, but you're the chef. You might make a different cake than I do, or maybe, you know, different even. As long as we're using sterile kitchens and we have, you know, foods, safe foods, we can provide amazing meals in a variety of ways. I don't know if that analogy really holds or not, but I really am passionate about people. I love talking to coaches on our platform and be like, I never thought of that. And that's the whole goal, that I don't have to think about your solution. You create it yourself.
Yep. I totally agree with you. Yeah. I would say, you know, coaching is, well, I would say that health and wellness coach training programs that meet the NBHWC standards, they all have the same basic recipe. They're like ice cream, right? Ice cream has the same basic recipe, but there's different flavors, and the flavors are, you know, do you add in peanut butter or chocolate or caramel, right? Like, you make it your flavor. And well, let's all follow the same basic recipe though.
That's a nice analogy, Leigh-Ann. Yeah, exactly. That's a really nice
example. I can turn any analogy into a sweet food.
Right, but it's well put, right? There's we're following the safe standards, we're doing it correct way. It's still, and so to me, the beautiful part of our coaching and what we're talking about here is the art of the science of it. We're following the science. The art is how we then use the science through that same lens, but in creative ways, and look at the data to help out, right? And the way I support my clients is different than someone else, and to me, that's the beauty. We shouldn't all be the same kind of coach. We should have variety of what we offer, because it mirrors a variety of people we serve.
Right. Totally agree.
Yeah. And so, Leigh-Ann, the hour has flown by. I guess I can't believe it's almost 2 minutes left here. Definitely would love to honestly have you back on and continue the discussion about all these things. But as we're closing off, maybe any, I was trying to be vague on purpose, but any kind of final thoughts on like for either coaches who are in training now, or just for the field, things that people should think about as they move forward in the field, like how do we continue growing and increasing our awareness of what this profession is and how valuable it can really support people?
Yeah. I think like the biggest thing I would say is don't be afraid to connect with each other. Like just this conversation, right? Like, I feel like we're giving each other ideas, thoughts, opinions. And I've had, you know, a lot of conversations with other coaches, you know, over the past 6 months. And I think that it really helps us all feel supported, and like, you know, we're growing as a field and an industry. I think we're going to have to really continue to join together to elevate this profession. It's not easy at all. It, you know, especially because it doesn't require the board certification, even though we know it's important. So just keep working together. And oh God, I hope, I see it's reconnecting. I hope we don't get dropped.
I saw it too. I got a little sweat on my brow as well, but I think it's okay.
I'm like, I don't know why this is happening to us today. This has never happened, but I think it's because the universe is trying to show us that we're resilient and we're not going to give up on this conversation. So maybe that's the message.
Nice.
That's the message.
I love that, Leigh-Ann. I love that. Yeah. And
we need to be resilient as a community of coaches. Not give up. Keep marching forward. And if it doesn't work the way you think it's going to work, find a different way.
That's a great
So,
way to end off. Exactly. Just like our client work, right? If it's not working, we learn what didn't work. And that community part is, so to me, foundational. Community is well-being, community is health. But also to me, every time I see people say, hey, I just passed a board exam, like, great, the community is growing. To
right,
me, the bigger the community is, the more leverage we can have for policy, for awareness. And I would say, to add on to this, sometimes coaches say, well, what about competition? Like, we're not at that stage of profession. There's plenty of people who can
yeah,
listen. We're working on ways to lower barriers for payment 100%
right,
with all these
right,
coverages. But already there's enough people who could afford it. They don't know the value that it is worth to get a coach every
right,
2 weeks or once a
right,
year. So
right.
right now, I think we have to do is collaborate to unify our voices
Yes,
and say, this is
yes,
what coaching is. Some people do
right,
coaching for pediatrics, some do coaching for this. The way medicine has different kind of doctors. And if we unify our voices and refer, collaborate, and create new ideas, that's how we're all going to grow together. I say we're too
yeah,
small of organization and lack of awareness. Awareness is a big limiting factor for coaching or what coaching
right.
is. If
A
we can
hundred, oh my
collaborate,
gosh,
that
yes,
opens up the field.
yes, yes. Yeah, and if one last thought, which is
Yes.
don't expect someone else to do it for you, right? So
Mm,
think about this. The board, National Board for Health and Wellness Coaching is there to offer the board certification, right? To unify
yes.
the field and to make sure that those training and education standards are being met and to offer the board certification. It is up to the rest of us to really market that board certification, to get the word out there about coaching. So don't sit around waiting for someone to do it for you. We have to all do it together ourselves.
Thank you. That really flashback. Maybe you and I were one more thing kind of people, right? That during a conference last year, someone asked, they asked you at the panel, why isn't the board getting more clients? And you put up a great point. The AMA doesn't get doctors' patients.
Right,
That's not
right,
how it works, right? They certify that
yeah,
you did the work, and now
right,
because of that work the boards did, the NBHWC, to give you the certification, you now have a leg up and can go talk about and do the work there. So really, that we have to collaborate with the NBHWC,
yeah,
know what they do, and be thankful for it. And because of that, we're more easily able to make those connections with providers, organizations. And like you said, everything's going to require effort. My mom said,
right,
every
yeah,
job requires a certain part that you don't love doing.
yeah,
Here's the reality.
yeah,
I've talked to so many thousands of coaches also. No one gets into coaching for technology or marketing. That's otherwise we'd
right,
be a software engineer, be a marketer.
right,
But we have to do some amount of understanding these things to do the things we like to do. So don't
right,
expect saying, well, I just gotta do nothing and people are gonna come find me. You gotta put some work in. Like you said, health is effort. Well, so is
yeah,
success. Put
yeah,
the effort in and
exactly.
retry.
Yeah. And there's plenty of us who understand the field, but like for me, I mean, I enjoy coaching, for very specific things. Um, but I love marketing. I love
Mm.
outreach. That right. So
See
like
you light up in your smile. You said that. Yeah.
I like to be that support person for the industry, right? So I think that there are a lot of people in the industry who have different skill sets. So
Yeah, and Leigh-Ann, we're lucky to have you. And that's to say, the organization. Some people are coaches and have technology backgrounds. Some have marketing
right.
backgrounds. Some have right. Can we all use background to work together? So, Leigh-Ann, thank you so much. Not for being
Welcome.
our guest, but I mean from the bottom of my heart for really helping create this path, this trail for us, and now we're all continuing to expand upon. Forever grateful and when happy to be connected and continue collaborating to grow the field together. Oh, we might have lost her, but it's okay. Thank you, Aaron, for this episode, and we'll see y'all very soon for our next episode. Thank you again, Leigh-Ann. Okay, there you are. I was saying, good goodbye. Take care, everyone.